All right, let's go ahead and get going. Good afternoon, everybody. Thank you so much for joining us. This is Interact for Health webinar on our recently released school-based mental health prevention RFP. Thank you all for joining us. I'll do some quick introductions of myself and my colleague, and then we will jump into, I'll share some background for those who aren't familiar with Interact for Health and our new strategy. And then my colleague will share more about the RFP and the process, and we'll have plenty of time for Q&A at the end. So feel free to drop any questions in the chat. And if not, save them until the end, and we'll have plenty of time to answer any questions that you might have. So again, I'll do quick introductions. My name is Ross Meyer. I'm the Vice President for Strategy here at Interact for Health. And part of my role is helping to lead the mental health team. So very excited to partner with many of you in the community on tackling the growing crisis that our youth are facing around mental health. And this is an important part of that. Deanna, do you want to introduce yourself real quick?
Good afternoon, everyone. My name is Deanna Hillard, and I am the program manager leading the youth mental health work for Interact for Health. Happy to be here with you all.
Deanna is the one to know on this. So she's leading up this RFP, and she'll share more about the specifics on the RFP and the process. All right, so let me share for those who aren't familiar with Interact a little bit more about us. We at Interact believe every person in our community deserves the opportunity for a full and healthy life. We've been working in this community for 25 years on promoting health and health equity. And we recently laid out our new strategy over the next 5 years, starting this year. I'll share more about that in a minute, but we've clarified kind of our vision and our mission. And our focus going forward is advancing health justice, working with communities and partners to ensure that everyone is healthy and thriving regardless of who they are and where they live. And as many of you know, we are far from realizing that vision, unfortunately, in our community, given the significant disparities that many face, including in mental health. And our mission is to try to bridge those gaps. Our values have been very important for us to reflect throughout all of our strategy going forward, and really we aspire to live up to these values every day in our relationships with our partners, like all of you. We aim to tackle root causes to get beyond treating symptoms and really tackling upstream root causes of the challenges that our community is facing. We're very focused on amplifying community power and really centering the voices and the experiences of those closest to the problems in creating the solutions. We speak openly with transparency and authenticity. We aim to partner with trust and really partner with all of you to reduce some of the typical power dynamics between funders and grantees and really work together hand in hand in tackling some of the significant challenges our communities are facing. We're relentless problem solvers, and of course, we strive for impact. So these are the values that we hope you see reflected in how we show up and how we partner with our grantees. Our strategy that we're focused on, this was based on a lot of input from hopefully many of you and others in our community last year, stakeholder input, community conversations, focus groups, looking at all the data, helped us really clarify these 3 priorities around the central vision, as I shared, around pursuing health justice, which for us is about really tackling health inequity, health disparity at its root, and addressing the social drivers of health at the root, and focusing long-term on ensuring everyone in our opportunity, especially those most marginalized, have a shot at living a healthy life. So our 3 priorities to pursue that, obviously we're going to do a deep dive today on mental health and well-being. That was clearly the #1 issue that we heard from stakeholders in the community, and is clear in the data, must be our priority going forward. It is the single health issue that we are really prioritizing to lend our support to help propel efforts forward and faster in that space, and I'll share more about our priorities there in a minute. Our other 2 priorities are really trying to tackle, again, the root causes of health disparity and advance health justice around pursuing policy and systems change within the mental health area, but also around the social drivers of health. We know long-term lasting change requires change in policy. So we're really ramped up our focus and our efforts, focused on advocacy at the local and state levels and supporting advocates at the local and state levels. We will have an RFP actually coming out shortly, focused on supporting more policy advocacy efforts. We also know that long-term health disparity has its root, as with many disparities, in power imbalances. So we're looking to partner with communities that have been most marginalized, that face the brunt of health inequity, to help them build their agency and voice on acting on their own priorities. So our community power building work really focuses on partnering with communities across our region, urban, suburban, rural, that have been most marginalized, and help them pursue their own goals and priorities for improving the health of their communities. That's where we feel long-term change can really come from. Our region is a 20-county region in the tri-state, Southwest Ohio, Northern Kentucky, Southeast Indiana. And of course, for this RFP, as with all of our grants, we look to support partners that are serving the people of this community. Within that region, as part of our strategic plan, we have prioritized the populations that the data make abundantly clear face the brunt of health disparity and health injustice. So these are the populations, including in this RFP, that we are aiming to prioritize: Black communities, Hispanic communities, children and families with low incomes, rural communities, and folks who identify as LGBTQ+. These are the populations across, not just within mental health, but across all health issues, are facing the brunt of health disparity. And we aim to focus our resources intentionally on supporting these specific populations. And as you'll see in this RFP as well, we're aiming to support schools and youth from these populations is a top priority for this RFP. You met me and Diana, or Deanna. The rest of our mental health team is here, and you might interact with them in different ways. Sonia Carrico leads our mental health policy work. It's the first time we have a leader focused specifically on advancing primarily statewide mental health policy. So if you're working in that space, she's your key partner. Michelle Leidenberg is our lead on data and learning, and she'll be working with all of our grantees on evaluation and helping you clarify and quantify the impact that you're seeking to make. Lisa Myers leads up our mental health systems work in the mental health equity RFP that we recently released. She's led that up, and Christine is our guru of all of our grants management systems. So she'll be your go-to partner for helping to answer any questions about our grant application system. So that is the team that we have here at Interact, focused every day on how can we help support your efforts and others in the community around improving mental health. A couple key clarifying points that I want to share before we dive into the content of the RFP. For us, we're defining mental health broadly. For many of you in the field, behavioral health is kind of the umbrella, and that's how we're defining mental health. The umbrella that includes substance use, mental health, well-being. And this definition kind of captures it for us. We believe mental health is health, shapes how we cope with stress, overcome challenges, build relationships, enables us to value and engage in life. Someone in one of our community focus groups last year put it simply: it just means being good with yourself. So again, we define mental health broadly, includes promotion of well-being, includes treatment, both mental health and substance use disorders. It includes support for those who experience and or in recovery from these conditions, along with their families and communities. So again, we take a broad definition. Obviously, within this focus, we're focusing specifically on the promotion and prevention part of the continuum. But again, we're defining mental health broadly to mean much more than just the absence of mental illness. Some of our priorities within the mental health area, we have kind of two buckets of work in our strategy. Supporting young people is a big part of that, including this RFP, as well as trying to tackle some of the larger system barriers within the mental health overall. So within supporting young people, you might have heard, some of you might have applied also for our Amplifying Youth Voice RFP. We really want to center young people and their voice in the solutions. Oftentimes, as Deanna often will say, adults are talking about what we think young people need without actually talking to young people. So that RFP aimed to really build the capacity of our partners to listen to and engage and defer decision-making on what program should be provided to young people. And we hope to see that sentiment and priority reflected in this RFP as well, to really engage students and student voice in shaping the services and programs that are being offered to their schools to make sure that they're relevant and as effective as possible. Obviously, a big priority that we heard from engaging many of our partners, we did a survey at the end of last year that surveyed the entire youth mental health ecosystem locally, and school-based prevention was #1 on that list, hence this RFP. We heard loud and clear that upstream prevention is woefully underfunded, underappreciated, and Interact has a role to play, as others do, to really lean in on the prevention part of the continuum. So this is one attempt to start to support expanding what we know works within the prevention space. We are also working with other funders on building support for a broader regional strategy around youth mental health. You'll hear more about this in the coming months, but we have so far 8 other philanthropic funders around the table that are looking to come together with all of you and many others to really think big and bold around how are we as a region going to turn the tide on some of the really scary trends that all of you are experiencing with the young people that you're serving. So more to come in the coming months on that strategy, but it's really an attempt to bring all of us, the whole community, together around a shared strategy with a common set of priorities that we can pursue over the long term, so that we can try to make a lasting impact on youth mental health. Outside of those areas, we're focused on kind of broader systemic issues within the mental health system, focused heavily on policy, as I shared Sonia and her work, and we'll be supporting more policy advocacy efforts in the behavioral health space at the state level, primarily in Ohio and Kentucky, to really advance change in what we know is broken around parity and reimbursement rates and lack of state funding, public funding for prevention, workforce issues. All these challenges that we know are barriers to us making progress are rooted in policy, and we want to really ramp up our voice and support the voice of others in affecting change in policy. We're also partnering with the Regional Behavioral Health Workforce Coalition to help, again, craft a regional strategy around addressing the workforce shortages within the mental health space. And finally, as I shared, the mental health equity RFP from earlier this year was focused very specifically on expanding culturally competent care for the specific populations that I shared: people of color, LGBTQ identifying folks, rural communities, low-income families. Really wanted to help bolster community-led efforts and help improve existing services to be more culturally relevant for those populations. And we're excited to announce those grant recipients later this summer. So with that, as an overview, I'm going to turn it over to my colleague, Deanna, who's going to share more about the school-based prevention RFP and process. Deanna, take it from here.
All right. So as we know that youth mental health, the status of youth mental health in the country is not well. We're facing a mental health crisis. Mental health challenges are the leading cause of disability and poor life outcomes in young people. Next slide. So the goal of this RFP is to expand evidence-based, school-based mental health prevention and promotion programs within schools that serve youth from Interact for Health's priority populations. Again, our priority populations are Black, Hispanic, low-income, LGBTQ+, and rural communities. This is a chart that kind of helps guide like the services that are needed. So tier 1 is universal Those are school-wide interventions for everyone, including students, educators, and staff. These are used to promote positive social, emotional, and behavioral skills. This is usually effective for about 80% of students. Tier 2 are specialized interventions and supports for students who are at risk for mental health concerns. Typically, 10 to 15% of students need this level of support. And last but not least, tier 3 is intensive. So individualized intervention for high-risk students with serious behavior challenges. So typically about 1 to 5 students need this level of support. So this is really, for us, the goal of this RFP is kind of focused on tier 1 and tier 2. So those universal supports and those targeted supports. So yeah. So our focus priorities are universal mental health screening, education and promotion programs, suicide prevention programs, and staff wellness initiatives. Project examples, sources of strength, QPR, youth mental health first aid training, signs of suicide, and evidence-based mental health education and social emotional learning programming. So one thing I want to pause right here. The reason why we want to call out staff wellness is from our conversations with our partners and just getting a landscape of the community. Adults are not well too. So if we're talking about school-based prevention, the teachers that are teaching the youth are not well too. So we would like to include some interventions for them too. So that's something that we've discovered on this new journey. Next slide, please. So our anticipated impact, we want to expand evidence-based program that increase positive school climate and increase students' knowledge of mental health, increase connection and belonging, provide the tools of healthy coping, increasing resiliency and promoting protective factors, conflict resolution skills, build skills to identify risks and prevent suicide, and promote mental health seeking behavior for youth. We want to improve school cultures of mental health and well-being for teachers and increase the skills of school staff to identify and respond to mental health issues, and increase availability of culturally relevant and appropriate and family support and resources. Okay, eligibility. So schools or providers can apply. So if a school is applying, we request a letter of support from your partnering provider. And if a provider is applying, we request a letter of support from the partnering school or schools. So the provider should already be providing evidence-based prevention programs in schools and are seeking to expand those programs to high-need schools, or providing more comprehensive programs within their partner schools. So this amount, we are investing $1 million in this initiative. Grants may be awarded for project-based or general operating support. Grant size and length will vary on the scope of the project. We are anticipating these grant amounts to be from $100,000 to $200,000 for 12 to 18 months. So some selection criteria that we will use to make our funding decisions: prioritize schools that serve our priority populations, again, Black, Hispanic, LGBTQ, youth and low-income families, and or rural youth. Authentically center youth in the project by seeking their input, acting on their feedback, elevating leadership, or sharing their decision-making power with them, implementing evidence-based prevention programs, and be from an organization with experience delivering those evidence-based programs. Also some more criteria: work to improve the health outcomes by reducing disparities and advancing health equity, have goals for the grant period that are clear, feasible, and align with the goal of the RFP, and demonstrate that the organization can achieve the goals outlined in the proposal with the budget, timeline, and staff capacity indicated. So these are due, applications are due Friday, July 7th at 5 p.m. And Christine does turn off the ability to turn it in. So make sure you get it in at 5 o'clock or before. Site visits will take place July 17th through the 21st. So please, when thinking about applying, just making sure if having those dates held off on your calendar. And then we will notify of grant award July 31st. Next slide. I will do my best to do the process, but we'll see. When Christine is back on Thursday, so if you have any questions. So again, to be eligible for this award, you have to provide services in one of our 20 county service areas and be a public or private nonprofit or governmental organization. Grantee requirements, depending on the project, awarded grantees may be expected to participate in grantee meetings up to 3 times a year to share their work and learning with other grantees and Interact for Health, and participate in evaluation and learning for the grant as well as yeah. So I would say as Interact is embarking on this new strategy, we want to learn from you all. So that's why it's key for us to bring our grantees together to kind of learn what's working, what's not working, and kind of learn from one another, because we're back in the mental health space and we want to learn from the folks doing the good work. Next slide. So if you are applying, please check out our website under the open funding tab. You will see that there's more information about this RFP. After this video, it's recorded, it will be posted on the website. And that's where you can also access our grant portal. If you have any questions with the process, please feel free to reach out to Christine. She will be back on Thursday. So yeah, next slide, please. So what kind of happens in a site visit? We don't want site visits to be super, we want them to be more conversational. We kind of want to know what's the project, what's the budget, population of focus, any disparities that exist and how the project plans to address them, community engagement tactics, collaborating partners and organizations, and your organization's journey around DEI. Interact is on our own journey related to DEI. So we would love to learn more about your journey. So that site visits can happen either virtually or in person. And we ask that if it's multiple people in a proposal, if you can, if possible, having all the representatives of the organizations of the grant being representative at the site visit. But more conversational. No, I don't need presentations. I just kind of want to know about the good work that you're doing. And now it's time for questions.
Yeah, I'm going to drop the slide so we can see each other, and we have plenty of time for questions. So I will share. I got one question in the chat, direct message that I'll share for everyone's benefit. So the question was, would a substance abuse prevention coalition that provides prevention programming be an example of a provider that could provide a letter of support, even if the school district is the fiscal agent for the coalition? And in a related question, for a school district that has its own in-house therapist, can those folks provide that letter? And I believe the answer is yes and yes. Deanna, you have any other thoughts on that?
Yeah, I think that is totally fine. We just want to make sure that anybody's just applying and they're like, oh, we'll get these people on board eventually. We just want to make sure all parties know and are aware.
Absolutely. Yeah, again, we just want to see commitment from the partners at the outset. And that's really what we're hoping to see with the letters of support. Yes, we will send out the PowerPoint and provide both the recording and the PowerPoint on our website shortly. What other questions do you have for us? One other point that I wanted to mention is that we, I don't think Deb Robinson's on the call, but we are hoping to work with Miami University. Some of you know has a center of excellence around school-based prevention and early intervention. And we're planning to work with them to provide support, technical assistance to all of you and however you might need it. around accessing additional resources and support for implementing your programs. So that'll be an additional resource, as well as any other needs that you might have. We're looking, as Deanna shared, to have a learning cohort together to share practice and to learn from each other about how to expand the good work that you're doing.
I see Stacy's hand is raised, and then we'll go
Yes.
to the question in the chat.
Go for it.
Yeah,
Feel free to drop a question in the chat or just come off mute. So go ahead, Stacy.
great, thank you. Can you talk to us about when you're talking about evidence-based programming? Are you talking about peer reviewed? Are you talking about like how tightly are you defining evidence-based?
It's a good question, Deanna. Do you want to? I mean, not as tightly as Samsung might. I'd say, for example. So I think we basically want to know is that we know that there is a lot of evidence about what works in this space, and what works has varying levels of evidence behind it. So we're open to considering all all approaches. We just want to primarily support what there is some evidence that it has a demonstrable impact on student wellness. But that evidence can be quite varied. So I'd say some might technically be evidence informed, others might be official evidence-based programs or practices. Our intent is, again, to support what works. And we recognize that the evidence bases might vary. So I'd say still submit. We're not taking a too restrictive of a definition as others might. Is that fair, Deanna?
Right.
Yep.
Thank you.
Yeah. Abby put in the chat, give more information about the letters of support. How many do we need? Once schools are back in session in the fall, we are hopeful to add more schools, but don't have that information now. So again, the intent here is to just have commitment. Obviously schools are out this summer, so we recognize that it might be difficult. So I'd say do what you can to get commitment from schools, understanding that there could be additional ones that would come on later in the year. Just indicate that, and we can try to be flexible. Again, we just want to see commitment from both the partner provider and from schools, that they agree to work together on this project. But we completely understand that summers are difficult for schools, so do what's feasible. And we do expect, again, other schools could be added later in the summer, later in the school year as you get underway. Let's see, Stacy dropped in. Do you have a preview review process? Can we ask questions if we have a few ideas to submit? Oh, great question. So I'd say, yeah, just reach out to Deanna. And we don't currently have any of the office hours that we held for the other RFPs scheduled, but reach out anytime to Deanna to just bounce ideas off of her. Get your feedback. We welcome that engagement and invite that so that we can hopefully be so that you're submitting hopefully what's most aligned with the intent of the RFP. So just feel free to reach out. If an organization has application under review for another RFP, would they be eligible to apply for this one? Yes. So, and we anticipate that there will be some organizations that could be funded under multiple of the RFPs that we have open now. If we get to that point, we'll just have a conversation with you about what makes the most sense in terms of how to structure the grant, one combined grant or separate grants, but don't let it be a barrier. Please do go ahead and submit for this one as well. What other questions do folks have?
I've unmuted. Is it okay if I just go ahead and ask a question?
Go for it.
I have to apologize. I was in a meeting and a few minutes late for the webinar. So if you've answered this, my apologies. But my question is, if a school district is looking to do some exploration of their current infrastructure to manage behavioral health, is that an applicable application for this process. So it's not so much the provision of direct services as much as let's take a look at our data. Let's understand where our mental health, behavioral health issues are, how we handle them currently, what kind of changes we need to make. So it would be that kind of exploration and planning in the infrastructure space more than in the direct service provision space. Is that anything in line with the vision of this project?
Good question, Rhonda. Danny, you have a thought on that?
I think, Rhonda, we might want to chat and give us a little bit, maybe we take that question on, because when I initially wrote this, it was only to expand services, but I haven't even brought that into consideration.
Yeah, it's a good question. We should follow up, Rhonda. I mean, we could think about it as a planning and an implementation component, right? So perhaps there's a planning component, but you build in funding to implement, what gets planned. Ultimately, the intent is to provide services to support the provision of services. So I think planning alone might not be sufficient, but there could be a way to think about it comprehensively to include in the proposal the planning that I think rightfully you need to want to do, but also include funding for implementing what comes out of that planning.
Sure.
That could be approached.
Part of the concern with the district is sustainability.
Sure.
And what are we setting up and being strategic and purposeful about how are we going to keep that going and that sort of thing. So that's where that question comes from, is what happens after the 18 months? How do we set up something that is sustainable?
That's a great question, and one that we don't have an answer to, but that we're going to be thinking about a lot too. I mean, we anticipate being in the school-based prevention space for some time, but we're not the long-term, funder. So the end goal here is to, build a portfolio of strong partners and programs that we know are working in the prevention space to ultimately continue to make the case for sustainable public funding. That's ultimately what needs to happen, and we can help fill some gaps in the near term and help continue to build out the evidence of what works in this space. But we hope to partner with all of our partners to continue to advocate for sustainable funding, primarily through public funding streams.
Perfect. And I'd love to follow up, Deanna. I'll reach out and maybe we could just have a quick conversation. Great.
Deanna, do you want to take this one? Vicki put in the chat, could a successful proposal focus solely on staff wellness, or will reviewers expect student services as well?
I definitely think that if you wanted to focus it solely on staff wellness, we're definitely open to that idea. So, yeah.
Yeah, we know a lot needs to be done to help our adults that are in the school building. So I think that's perfectly acceptable. Other questions that folks have for us? Anything else come to mind? If not, we will wrap up. And but again, feel free to reach out to Deanna anytime you have any questions that you want to talk through or just bounce ideas off of. Just reach out to Deanna. I will follow up and send out both the slides and the recording from the webinar for everybody. And I'll include Deanna's contact information as well. But in the meantime, thank you all for the important work that you're doing for young people and the adults in their lives. And we appreciate what you do and hope to continue to build on it and expand it to more young people. So thank you all, and feel free to reach out if any questions come up. All right, take care, everybody. Have a good rest of your day.